we decided the cohort that we would look at is people aged 50 and over who are living with frailty, particularly moderate frailty. This was due to a number of factors. Some of this is understanding our data and utilising that. We know that we have an ageing population. They have complex needs. We know that there are some medical needs, but also a lot of non-medical needs as well. So we wanted that approach, which would look at combining health and communities together, looking at the different aspects of somebody's life, and also because we know we have health inequalities a lot in our area, how could we use this programme to do that as well and start to understand that in more detail.
So we wanted to adopt a kind of peer-to-peer model of research and engagement, and then we supported them to go out and engage with the population.
I think we've learned that those patients that take up a lot of acute resource also take up a lot of primary care resource as well.
We've done a big focus on what the data has revealed to us, and the health resources consumed by certain cohorts of patients are not necessarily the best use of health resource. So what we're trying to pick out is where early intervention might prevent huge resource costs further down the line. So that's been a real positive impact of population health management that we've started to utilise.
So population health management approach from an individual patient perspective is about really reframing the way we work with patients. So just in the way that we're gathering greater insight into the data, we're also working in new ways with patients, starting with what matters to them. So if we do that, then we understand the intrinsic motivators that are really important to people, and that means that we can start to work in a more holistic, person-centred way with people.
Well, for me, I think it's been an exciting opportunity to work with frontline clinicians, commissioners, people from public health representatives and the community in a constructive manner that's used data governance and data information in a sort of an analytical business way to bring out these frailty people or patients. I think the use of the data in the systems has been very good to highlight those individuals.
For me, it's been about the opportunity to really promote the value of the voluntary sector. Council Voluntary Service have been around for 8 years in this area plus, and it's something that we are very passionate and enthusiastic about, supporting our voluntary sector organisations, especially the ones that are volunteer led, so the really small ones. And I think it's been a great opportunity to build that relationship and enable referrals into those sectors through the programme that we've been doing at the moment, and it's built on our existing Community Connector programme.
As you get older, people want to recede into the self, whereas here they come to luncheon clubs, they come to bingo clubs, and they help build little families, and that's what we have. They're not friends, they're families.
Population health, they say, is 10% data and 90% culture change. To bring culture change, we cannot repeatedly do the same things we used to do. It's a question of doing things differently and do differently to our strengths. In this case, it was the community. And that is why we have stepped out. We are bringing the message of population health management to the people, to activate them, to make them aspire for better health outcomes. And this is what we are doing.
Okay, I think we've had a really enjoyable experience. It was amazing to see the different disciplines coming together to explore the data, look at the community services and the offer, and then work together to design something really different for our local communities.
It's been a real privilege to be part of the population health management pilot, And what we found is that actually data is only 10%. What really counts is the way in which we apply our learning and insights in the real world, and that's the real world in which our patients, their loved ones and our local communities live.
It's been a really exciting opportunity, and this project has allowed different individuals from different backgrounds to come together to dissect the data. We think we've found a very, very simple but realistic model that can be reproduced and used for any clinical condition. We're hoping that we can work closely with some of the other networks in the area and share the learning so that we can use this model across the board and apply it to any clinical condition. And I think looking for solutions within the communities itself and trying to help those communities become more resilient, more confident, and allowing them to become more connected so that they can help themselves in times of need.